Members of Congress are back home holding town hall meetings on the issue, and in meeting after meeting, there's been a pattern of disruption. Opponents of change shouting at members of Congress so loud at times police are called in. White House spokesman Robert Gibbs said today, "We can discuss these issues without being uncivilized. It's the same thing I tell my 6-year-old." Here's Jonathan Karl.
Snapshots from the healthcare debate in Michigan.
I want to know if it's coming out of my paycheck, yes or no.
Your employer supports you.
I want an answer to the question. Is the money coming out of my paycheck?
In Georgia.
They've decided that we're just stupid.
You in Congress have a Cadillac health care plan.
In Florida.
And I don't want the government to do it for me.
I am not a right-wing wacko.
After people were told they can only submit written questions, a town hall meeting with Michigan Congressman John Dingell got ugly.
I have a question for this young man. Go sit down and we'll I have a question for this young man.
The man refused to sit down, so he and his wheelchair-bound son were ejected by police. We came down to Congressman Tom Perriello's district in rural Virginia to try to get a sense of just what is going on at these town hall meetings and who is showing up.
There's nothing in the bill about health care. It's health insurance and who pays for it.
Will they be able to choose their own doctors?
I don't like it.
Most of these people don't like the Democratic health care plan, but they're not happy with Republicans either.
Let me ask this question. How many people here think Democrats spend too much money? How many people here think Republicans spend too much money?
What outrages them most is being called a mob.
And now, if we have a little dissent, your party seems to take an issue with that, and I am very upset by that.
They're telling us we're a bunch of nuts out here. I'm a 20-year veteran in the Air Force. I coached wrestling at the high school for 5 years.
Everyone we spoke to here lives here.
Most of this is legitimate local dissent. Some of it expressed very eloquently, some very vocally.
Some simply want answers. What do you think?
I have more questions. I don't have that much confidence in it. I don't see where it's going to make that much of a difference. It's going to be more of the same.
Even those inclined to support health reform have their doubts.
500 pages. I read it. And
you read all 500 pages?
I read all 500 pages. And even after reading it, I'm not clear on what they're trying to say.
Apparently, reform advocates have a lot more explaining to do. Jonathan Karl, ABC News, Chatham, Virginia.